Good morning everybody, my name is Mary Scott. The purpose of this video presentation is the analysis and critique of a systematic research study to ascertain the authenticity of the study. A systematic review uses an objective and transparent approach for research synthesis. The interpretation of research findings is a search for the broader meaning and the implication of the results of an investigation. The critique of a research, according to Pollitt and Beck, it is an objective, critical, balanced appraisal of a research report's various dimensions. The article we're going to analyze today is a systematic article. The article topic is the relationship between nursing leadership and patient outcomes. It is a systematic review by Carol A. Wong and Greta Cummings. The first section of analysis is the research problem. Two reports published by Institute of Medicine in USA indicated the problems of errors in healthcare facilities and stressed that a strong nursing leadership is mandatory to create a culture of safety. A similar Canadian report also justifies the need for nursing leadership. A change in nursing environment was necessary to increase the patient's safety. These issues were signaling a call for change in nursing leadership to improve patient outcomes. There was not much known about the actual relationship between nursing leadership and patient outcomes. Hence, a greater understanding of the role of the relationship in patient outcome was necessary. So, this systematic review report clearly stated the research problem, and the topic of the review is important for nursing. In this review, the integration approach was described adequately and the approach was appropriate. However, in this study, variables were not adequately defined. I think the independent variable could be the nursing leadership and the dependent variable could be the patient outcomes. The next section of the analysis is the search strategy. An expert panel guided the review process. The authors searched 10 databases using a broad range of keywords, which they listed in a table of their report, like CINAHL, HealthStar, Medline, and ABI and Coherence database. There were 10 of them listed in the article. Also, the manual searches of 4 specific journals and 8 websites also performed. And several methods were used to identify the studies in the grey literature. However, the report did not describe the criteria for selecting primary studies, but the bibliographic database used by the reviewers were identified and they were appropriate and comprehensive. A Prisma type flowchart was included to summarize the search strategy results. According to Pollitt and Beck, a Prisma is a preferred reporting items for systematic reviews and meta-analysis is an explicit reporting guideline which is useful for writing up a systematic review. The next area of analysis is the sample. 5 specific inclusion criteria were set up as the screening tool to select the articles. The inclusion criteria of this review were, there were 5 of them listed. The first one was the study measure formal nursing leadership. The second one, leadership styles, behaviors and practices. The third one, the impact of leadership on patients. The fourth one is only quantitative and qualitative research articles which were English only was selected. The fifth one is the relationship leadership and patient outcomes. Both quantitative and qualitative research articles that met the criteria for selection were chosen from the electronic database and manual searches from specific journals and websites. Of the 14,042 studies initially identified by the titles and abstracts, 1,214 abstracts and titles were selected first, and again a second selection which emphasized the nursing articles resulted in 99 articles. And those 99 articles screened according to the inclusion and exclusion criteria and resulted in 18 articles. Of them, 16 quantitative articles and 2 were qualitative articles. However, the primary author eliminated the 2 qualitative articles as it did not address all the 5 inclusion criteria. As a result, only 7 quantitative articles formed the sample for the final selection of the study. This review report presents a Prisma-type flowchart showing the researchers' sampling decisions. The search strategy yielded a strong and comprehensive sample of studies. Strengths and limitations of the sample were identified correctly. The inclusion and exclusion criteria were clearly articulated and they were justifiable. The inclusion criteria were listed as in a table format in the articles. The reviewers provided a rationale for the decision of inclusion and exclusion of studies. The next section of the analysis is the quality appraisal. Each published article was reviewed twice for the methodological quality by the first author using a quality rating tool. In addition, the second author validated the quality assessments. The adapted tool is listed in the figure 3 of the report and was used to assess 4 areas of each study: the research design, the sampling, the measurements, and the statistical analysis. The instrument reliability was reported in 5 studies and validity in 2, but all studies with measures for leadership and patient satisfaction used instruments with established reliability and validity. On the other hand, majority of the studies utilized non-experimental, cross-sectional or descriptive designs that limit interpretations of causality. Only 2 studies utilized the randomized sampling. According to Pollitt and Beck, the quality criteria vary from instrument to instrument, and the result is that study quality can be rated differently with different assessment tools. So in this study, they definitely used an assessment tool. That is a positive point. The reviewers appraised the quality of studies by using a well-defined quality appraisal scale. Also in this study, both authors did the quality appraisal separately, and the inter-rater agreement was reported. According to Pollitt and Beck, at least 2 qualified individuals should do coding for quality elements in studies. The next area of analysis is the data extraction. The several data were extracted from 7 quantitative studies. The author, the journal, the country, the research purpose and question, theoretical framework, design, setting, subjects, sampling method, measurement instruments, reliability and validity, analysis, leadership measures, measures of effects on patients, significant and non-significant results, discussion and recommendations. These are the data extracted from the 7 quantitative studies. So in this study, adequate information was extracted about the sample characteristics, study findings, and methodological and administrative aspects of the study. According to Pollitt and Beck, a data extraction form must be developed along with a coding manual to guide those who will be extracting and encoding information, and basic data source information should be recorded for all studies. The next section of the analysis is the data analysis as general. 14 different outcome variables were reported in these 7 studies. For data analysis, after extracting data, the researchers categorized 14 variable outcomes into 4 themes based on content analysis. Relationship between leadership and patient satisfaction. So from the 14 variables, they made 4 themes. The 4 themes were relationship between, the first one was the relationship between leadership and patient satisfaction. The second one, relationship between leadership and patient mortality. And then the patient safety outcomes like adverse events, and then the relationship between patient safety outcomes like complications. So according to Pollitt and Beck, first major step in a data analysis is to organize and index materials for easy retrieval. That was done in this study. Also in this study, the reviewers used tables, figures, texts to effectively summarize findings. The reviewers also explained their method of pooling and integrating the data. A summary of findings is data analysis findings is also presented in the table 4 of the review report. According to Pollitt and Beck, the tables and figures typically play a key role in reports of a systematic review. The next area is the data analysis quantitative. This systematic review failed to include a meta-analysis. This systematic review used only quantitative studies for the review. So a meta-analytic technique was feasible. According to Pollitt and Beck, systematic review of quantitative studies often involve statistical integration of findings through meta-analysis, a procedure whose advantages include objectivity, enhanced power, and precision. But a meta-analysis was not performed in this study. Pollitt and Beck also stated that if the reviewers decided that a meta-analysis was not justified, the rationale for the decision must be made clear. So in this study, the reviewer provided adequate justification for not using a meta-analysis. This is the quoting from the article. The article says that a variety of outcome measures and heterogeneity of samples and settings precluded meta-analysis procedures and limited the consolidation of findings. So, as Pollitt and Beck stated, they justified the reason why a meta-analysis was not performed. The next section of analysis is the data analysis qualitative. As this systematic review did not use any qualitative studies, a meta-synthesis or meta-summary was not undertaken, and which is justifiable. The last section of this systematic review analysis is the conclusion. Evidence of significant association between positive leadership practices and increased patient satisfaction and reduced adverse events were found from the study. This review has shown that research examining the relationship between nursing leadership and the patient outcome is relatively recent, because most of the studies were published within the last 5 years. The findings of this review also suggest evidence supporting a positive relationship between transformational nursing leadership and improved patient outcomes. The review suggested that an emphasis on developing transformational nursing leadership is an important organizational strategy to improve patient outcomes. So according to Pollitt and Beck, A thorough discussion session is crucial in a systematic review, which was already provided in the article. So the Pollitt and Beck state that a thorough discussion session is crucial in a systematic review, and the discussion should present an assessment of the overall quality of the body of evidence and the consistency of findings across the studies. The implication of the review should also be described. As the Pollitt and Beck stated, the implication of the study and the thorough discussion was performed in this study. This systematic review proposed that further studies with more diverse and randomly selected samples are needed to advance knowledge of the complex multivariate influences among leadership and patient outcomes. Therefore, in this study, the reviewers drew a reasonable conclusion about the quality, quantity, and consistency of evidence relating to the research question and implications for nursing practice, and further research were clearly stated. So, in conclusion of this systematic review, this review was a proper systematic review, which consisted of a specified inclusion and exclusion criteria, complex search for evidence sources according to the search strategy, critical evaluation of study findings, implication of study findings, discussion for further research, and evidence-based conclusions. Pollitt and Beck suggested that readers of the systematic review need to be able to assess the validity of the review, and their rationale should be described, which was true in this review report. An understanding of the systematic review and how to implement them in the practice is one way to implement evidence-based practice in healthcare. Evidence-based practice relies on research evidence, and the systematic review integrates those research evidence. Many healthcare practitioners consider systematic review as a cornerstone for evidence-based practice. That was all about the systematic review. The reference for this review include the article by Wong and Cummings, The Relationship Between Nursing Leadership and Patient Outcomes, a Systematic Review, and the textbook, the Pollitt and Beck, the Nursing Research Generating and Assessing Evidence for Nursing Practice. Thank you for watching. That's all about.